Anyway, I'm delighted to be accompanied this morning with Dr. Juliette Whitney. I've known Dr. Whitney for a very long time. It's kind of been what, like 5 years now, something like that.
I I don't know. I don't even remember. But yeah, you've worked in two different places, so I guess it's been a while.
Yeah, I think the first time I met you, you were doing like you were heavy into CrossFit.
Not that much. I had like maybe a couple of months into like CrossFit, and then I injured my hip, or like I had like hip pain, and that's how we met. Yep.
Yeah, yeah. Now I remember. By the way, I just want to let it be known that I support CrossFit and the community and the exercise modality. So this isn't me trying to imply that CrossFit causes pain because it doesn't. Anyway, I'm delighted to have Dr. Whitney on because Dr. Whitney is on. I'm just going to call you Juliet moving forward because
Yeah, it sounds weird.
we don't have to be so proper. But Juliet's on a in a pediatric residency here in New York City, which made me feel like she'd be a great guest to have on to talk about children, childhood development, and physical activity in the childhood and adolescent population. But how's your residency going?
It's going great. I guess I'm lucky to do what I love, and working with kids. It's amazing. Especially during this pandemics, like that we saw like so many like bad cases. Um, and most of the population that was affected like were adults. But busy working, studying, like trying to balance life. Um, but when you do what you love, I guess you're always having fun. I'm in my second year of pediatric residency at a children's hospital in the Bronx, and that takes a lot of my time. But we gotta learn. We gotta see patients. Yep.
Yeah, for sure. And I mean, I certainly love what I do, and I think you can see that. And it certainly does feel less like a burden when you're obsessed with what you do for a career. Now, I know you're only in your second year of your residency, but what would you say would be the most challenge? Have you had like a really challenging case or anything that was like, whoa, this is like I never expected to come across this, and but you're also grateful that you did?
Um, I think. I mean, I don't. The cases that I don't like are usually like the child abuse cases. Um, yeah, like that always makes you think like, why would people do things like that?
Mm,
I think those are like the most challenging ones.
yeah.
Yeah.
Would you
Or
say?
like when
Okay.
they don't get better, and like you expect them to get better, but then they have like something like an underlying disorder, and like, you know, I'm used to like kids being resilient and like getting better. And like, that's why I chose this. Cause like, I don't want to be around very sick people all the time. Like I love the fact that kids improve, that they can change, that you can like change their behavior, like their change their lifestyles and things like that, and then like change their future. So yeah.
Yeah, I mean, I don't have as much experience as you do with children, but I certainly know that uh, the child's developing brain and just overall ability to learn and grow is just incredible. Now, saying that, I know that we're all still, I guess the pandemic is still a thing. We can't say we're out of it yet, but because of that, I know that children weren't able to go to school in person for quite a bit of time, and I'm sure that you've noticed a lot of them hadn't had a lot of social interaction with other children. Did you see any difference in your population because of those changes that children had to go through? Like, I don't know, maybe less serious cases in the hospital, or maybe their behavior was a little bit different.
So like we closed our outpatient clinics during COVID initially. And then after that, we have, at least in my residency program, we have been only seeing healthy visits. and some of like the sick visits, but like kids that would come with symptoms like hip pain or like foot pain or things like that that are not related to any type of respiratory issues, because we don't want to like expose other patients to possible COVID or any other respiratory viruses. But it definitely changed. The population changed. Now, like we're seeing patients that had not visited the office for like 16 months or 6 months, like, and that's a long time, especially in a kid so young. Like if they saw the doctor when they were like 1 month old and now you see them again when they're 15 months old, well, that's a huge time frame. um and yeah, like most parents, they were afraid to take their kids that were healthy. What will you take them to the doctor's office where you could like um be with another person that was sick, you know? But yeah.
Yeah, do you think that the time that was missed because of COVID, do you think that's going to have longer term impact on those specific children in terms of like, I'm not an expert in pediatrics, but I do remember receiving a lot of vaccinations. At least my chart indicates that I was
Hmm.
vaccinated quite a bit before I could consent to it. But I'm grateful for that. I'm grateful for that. Um, but I don't know, do you feel like children are going to have more difficult time? Are they going to be exposed to being sick later in life or not? Or you think they'll still be all right?
I think it's like too early to say that, but like everyone has been indoors. They have been trying to like social distance, like they have been wearing masks, like at least most people, doing like good hand hygiene.
Mm.
And right now they're doing like their catch-up vaccination. Like, so they're catching up right now. We're definitely seeing like respiratory viruses earlier than we thought we would see them. Like we have been seeing like kids with RSV and other respiratory viruses at least for like 4 or 5 months, like, which is crazy, like during the summer to see like winter viruses.
Mhm. Is
Yeah,
there any
and like
particular?
I, yeah,
Not bad.
and I don't know like about the data, but like we have seen like atypical presentations, like they have been giving like severe symptoms for longer than we were like used to see. Yeah.
And that increased incidence of viruses is attributed to just not having been going to the doctor for a while, or is for some other reason?
Um, I don't think it's because they haven't been seen by doctors. I think it's just because of the fact that right now, like kids are back to school, going back to daycare, people are back like in work. So,
Yeah. Yeah,
mhm.
for children, it's like they also share the home with siblings and parents, so a lot of
Mhm.
potential. Yeah, I know it's down where I work in the financial district. I think most offices are starting to at least go back part time, so I can definitely see how people could be exposed more. But I am grateful because I think we need to interact with other people. I mean, certain people might want to work remotely for the rest of time to spare a commute, but I think interacting with other people, and I'm grateful for my profession and I get to do that. It's really a lifesaver. It really keeps you intrigued. It breaks up the monotony of a day, and I really like it personally.
Yeah, it's like part of who we are as humans, and kids need this type of social interaction to like, especially for their development.
Mhm.
So it had to happen at some point.
Yeah. And I think this is a good segue into another topic that's a little bit more relevant in my realm of physical wellness. And it's that although children do need to interact socially, I think there's a lot of value in play. I think the research supports that as well. At least, and I started to see it in my generation growing up, that more children are becoming sedentary with technological improvements, with video games and more options for streaming services to stay inside and watch movies. Have you noticed a trend with more children, leading sedentary lifestyles, or has it been relatively the same?
So as you said, like I've been seeing kids only for 2 years, which has been like also very atypical because that was like the beginning of COVID.
Right.
Um, but there's like limited data, and like we have like preliminary findings that like yes, we have seen like a downward trend in physical activity levels in kids, especially during COVID. And it had to do with like the fact that we had to like quarantine, social distancing, that schools closed, parents had to work from home. Yeah, like everything happened so fast, and we had to stay at home for like over a year. So there's definitely an increase in sedentarism in children.
Yeah, and
Even like before COVID, like we knew that like the rates of kids that um would do like the target of like 60 minutes of like moderate to vigorous physical activity was like in the low percentage, was like 24%, I believe.
mhm.
So now it's even like lower than that.
Wow, lower than 24%. That's crazy. And I
Yeah.
and I knew it was pretty low, but I didn't know it was that low. And I mean, I'm a fitness junkie now, and I think as a kid, I used to pound an ice cream sundae after dinner sometimes, and then just play video games with my friends and drink soda. I can't even believe how much soda I used to drink. But luckily,
Mm-hmm.
I was able to change that. But I guess with physical activity, it's more than just the lack of desire to move. I think there's a lot of other factors, and a lot of what we talk about moving forward could be more anecdote than necessarily supported by research. But seeing all these children with lack of physical activity, what do you believe some of the barriers might be for those children to get out of that cycle of being sedentary, possibly developing some childhood obesity issues among other medical issues?
So I've had a few patients, and it's like pretty common to see kids that like are overweight or that are obese. And the first thing that I notice always is that when their parents bring them to the office, they always make comments on their weight. Like they're like, oh, like they're fat. Like I'm pretty sure they will. Like I even had one that would say, like in front of her son, like I think he may qualify for the surgery. And I was like, what do you mean? Or like, so it's like really hard. I think that what we have to do is like to educate. You can educate like the children, but you also have to focus on their parents because what's going on is not only because they don't want to work out, but like they're young, so they don't know how this is going to affect their future. One thing. Two, they may have some self-esteem issues. So they may not have that willingness or that yeah, that willingness to like change what they have. They may feel just like comfortable with who they are and what they're doing. um I think also habits, like having new habits, it's like really hard for kids, like even for us as adults, that we know what's good for us and what's not. It's really challenging. um yeah,
Yeah,
so yeah, it's we know that like having a sedentary behavior, it's a risk factor for heart problems, for like mental health, um, for our bones, for and for like future like chronic diseases that we could have as adults. Um, but I believe it's like a group effort that we have to do. It's not only the kids, it's also the parents, it's also the public health that includes pediatricians in there.
yeah. I definitely can see when you said self-esteem, I thought about myself as an overweight child and thinking about why going to a swimming pool. It's always like that neighborhood swimming pool thing where you have to take your shirt off and you feel uncomfortable because you're overweight and the other kids might not necessarily be, and you're just like at a very low point, and it's hard. Like, I think if any parents are listening to this, I want you to understand that it's important to, and you can comment on this if you like, but it's important to have honest conversations with your child. Make sure
Mhm.
that, underneath it all, it may not all be great, even though they're putting on or at least displaying that they're potentially happy, or maybe they have behaviors that show that they're not. So I think it's important to really connect with your children, because it was definitely a sensitive subject for me, and then getting picked on in elementary school, because kids are ruthless sometimes, and sometimes when
Yeah.
especially when your comfort zone is making poor like food choices as a means of coping with that negative talk and self-talk and just overall bullying to a degree, it just becomes a negative cycle, and you want to try to break that as early as possible.
Yeah. Like kids, have no filter. So in school, like they will say whatever comes out their mind. Um,
Hmm.
but the thing is that like there's like research that shows that bullying usually starts at home.
Interesting.
And yeah, and starts with parents. Like they may say things that they don't think are hurtful, but um yeah, that happens. Like
Yeah, we call things like that nocebos in. I mean, it's in the medical world in general, but saying something that is hurtful, even if it may not be intended to be hurtful. So we have to choose our word. One of my favorite sayings all time is, um, "Reckless words pierce like a sword, but the tongue of the wise brings healing."
mhm.
I just wanted to sound philosophical for a little bit, but it is something I believe in. So understanding like the right type of words to use with a child and the right time, I think that's like next level parenting, which I'm not a parent yet. Someday I aspire to be. Still looking for someone to be a parent with, but that's for another podcast episode. And this is not a call to action for me looking for a baby mother. I'm not yet, not yet.
Well, now everybody knows.
Anyway, you made a comment before about the general physical activity guidelines for children. Could you repeat that again? I think it was like 60 minutes of moderate activity. Is that correct?
Yeah, 60 minutes of moderate to vigorous physical activity every day.
Every day.
Um, every day. And for kids between 5 to 17. And then they recommend like bone loading and muscle strength also activity at least 3 times per week.
So by saying muscle and bone loading, does that mean that, in your opinion, would resistance training be a safe thing for children to do?
I think so. I think if they're able to do it properly and with the right technique, I think it's safe.
You hear that, children? Go grab some weights and find someone to help you learn how to do it safely, because it'll also keep you away from the video games for a little bit too. And
Mhm.
there's also just a lot of inherent benefits to resistance training other than muscle loading, especially for mental health, just feeling resilient and strong. I know I've seen transformations in my own body and some of those in my clients as well from resistance training. So I think getting people into that habit early on is something I wish I had as a child, when I was pretty much just doing like park-based sports. And I know that sometimes you don't have a gym necessarily available, so that could be a barrier to getting some resistance training in. But plenty of things you can do at home nowadays as well.
Mhm.
But I think the challenge for resistance training in children is trying to make it fun. Sometimes just like picturing someone in a gym lifting weights could be pretty boring. So
Yeah.
I took a couple courses with a chiropractor, Dr. Craig Liebenson. I really respect his work and I love his treatment philosophy. And he's always talking about gamifying movement. So like trying to just like have fun with it and make like and I know pediatric physical therapists are probably better than I am at this. It's like just trying to make a game out of an exercise so that you're not so
Yeah.
specifically on like, oh, I'm lifting this weight. It's like, oh, I have an objective. There's a task here. I have to complete it. But at the same time, it's accomplishing like bone and muscle loading. And I think uh, there's no right way to do it, but I think that that would be the way to get children
Yeah.
more into resistance training.
Yeah. And like we have to start early as parents. I mean, when kids go to the office, we see them like once a year only. So most of the work will be done at home. What we do is just like counseling and like we identify if they have like any risk factors. We try to educate parents, but most of the work will be done at home.
Right.
And then, yeah, like first thing that we always tell them is like find something that your kid loves, and then that won't be a burden for them. It's not like you're like pushing them to do something. They will be the ones that will take the lead in that part. The other thing is that they need family support. So if you have an older brother or an older sister, whatever, or even as a parent, and if you work out, like if you jog, if you run, take your kids with you. They may like it, they may not. I used to run with my father when I was younger. I don't like it anymore, but I enjoyed like talking to him and spending
Yeah,
time with him. Yeah.
for sure. I mean, I also don't like running very much anymore, but I was grateful, and I still am grateful. My father's still in my life, and he doesn't like sports at all, but he would at least like take us to the park. I always remember my brother and I like he would like pitch to us and play baseball, and we would hit the ball, and he would always just like facilitate us doing active things. So
Mhm.
that was super, and it also helped us build a stronger bond with our father. So I think I'm one of the lucky ones to have a father that wanted to be so involved in our development, and I like to think that I turned out okay after how he raised me. So fathers, mothers out there, make a conscious effort to be in your child's lives. Now there is something I was wondering, because I haven't been in a elementary school or any sort of school in a long time. Uh, we used to have a pretty long recess period and gym period in when I was going to school. Have you heard anything about that changing? Like, are kids getting less physical activity in school now?
I don't know about like right now because I know that they're back to school. They like things may have changed.
Right.
But like when they were doing remote learning, they had like 15 minutes per day to like do physical activity plus whatever gym class they had.
Mhm.
But I think we're probably back to what they were doing before.
Okay. Yeah, I
That's
mean,
that's what I assume.
yeah, the only thing I know about elementary schools now is that the water fountains are too low for me to drink from, and that the toilets are like you really got to squat down to go into the urinal. But other than that, I haven't been in a school in a while. So just
Me
curious.
neither.
Yeah, I mean,
Yeah.
but I would actually, if there are any school administrators out there listening to this, I am more than welcome, more than happy to do any sort of outreach to children to help get them motivated to move earlier. So hopefully, anyone out there who is interested, I'm more than happy to talk about how we can make that happen. Because I do think we need to start early with children and get them excited to move and get them to understand what we were discussing before about tackling all these aspects of overall well-being and health. So just a call to action there. But Juliet, in terms of, I guess if anyone listening wanted to take something away, like say they didn't listen to any of this and they tuned in right now, what would you say would be like one or two takeaways that someone could derive from listening to this that would help them be a better parent or get their child to be healthier?
Um, I just want them to know how important it is for kids to do any type of physical activity. It's not just about their bodies, but it that like we have data that shows that it also helps with internalizing behaviors like depression or anxiety, or externalizing things like aggressiveness or impulse control. So it's not just about their bodies. So this is really important, and they should start as early as they can. I think that it could also help them spend like quality time with their children. So find something that either you like and that you think that your kid may like, and share time with them, or try to find something that they like. Try to encourage them to like do activities in family with the family, or if they have a friend, like try to encourage them to do things together. Take the stairs, don't take the elevator. Try to walk to school if it's within a reachable distance. But yeah, also the amount of physical activity that kids do like daily, it's related to the amount of screen time that they have. So as parents, we can set rules, and at some point we're responsible of the amount of time that our kids spend in front of a TV, or playing video games, or like in social media. And so we have to set boundaries. It's not about like being the bad parent, but it's about like caring for them and caring about their future, because like physical activity can do a lot for them.
Yeah, I already told myself that if I have a family, and I hope I'm lucky enough one day to have one, that I'm gonna be going on like a national park tour with my children, just like hiking up mountains and like driving across the country, just to like so I can hike, they can hike, and everyone, because that's something I enjoy doing. So to keep my kids active, get them in the habit early, definitely something I have planned.
Mhm.
But in terms of because I think we're approaching the end of this. So you're in your second year now. So what's next for you in terms of like how many more years do you have? Do you have any other rotations coming up?
I'm in the pediatric ICU right now. I am going to an outpatient rotation, which is a little bit more laid back. But by the end of this year, I will be a third year resident. And for now, I think I'm going to apply for a fellowship. So that would be either 2 or 3 more years. But yeah, I'm looking forward to it. It's what I want to do. So yeah.
Yeah, and I think the world is going to be, or especially New York City, is going to be a better place with you leading the front lines of our pediatric centers of development. If you choose to do pediatrics in the long term, just knowing you as a person and what you've shared with us today, I think any parent who brings their child and trusts their child with your care is going to be rewarded. So I really do hope that you continue your amazing work with children, and continuing to stay in touch with me, because I look forward to seeing how you progress during this journey. Um, and I'm really grateful that you took time on a Sunday morning when you don't have a lot of time as a medical resident. Is there anything else you wanted to say before we sign off?
Yeah. I just like want parents to be aware that our kids need reinforcement. They need to be told what they're doing right, what they're doing wrong. But we have to do it in a very loving way. And even if they don't lose weight, but they're keeping their weight, just like be there and saying like, yes, you're doing this right. Like you have not gained any weight. If they're losing weight, even better. But you have to celebrate even the small changes, because that's what like make them continue,
Yeah,
like if
go ahead.
oh no because like as a child, I think sometimes you're looking for like what your parents have to say and their attention, and for like yeah. So I just like be patient.
Yeah.
I I am not probably gonna do primary care, but I also struggled with weight issues initially, and I think that my parents were always like they didn't say anything to me, but my dad was like, "Do you want to go running? Do you want to go play soccer?" And those are things that stay with me. I may not have even liked running in the first place, but the fact that like I got to like do something with him, I really love that.
Yeah, I think parents, it's important to set the table for your child's success. Like, be active, as Juliet was saying, and give your child the best resources possible to make good decisions. You don't want to set your child up for failure. And you, I think as long as you're doing the best that you can as a parent, even if it's not necessarily like, like maybe you have too much soda at home and you don't think it's that bad, but maybe
That's another thing.
start taking some of that soda away, or again, carve out the time for your child. Make a healthy lifestyle as possible as can be. And I know there are many resources that and barriers for that matter that keep these things from happening. So I don't want to sound like I'm insensitive to the fact that it's easier for some than others. But if you do the best you can, I think you have to be proud of yourself as a parent that you're doing everything you can to give your child the best possible opportunity. But even if you run out of resources, there are people like Juliet, like myself to a lesser degree, and just a whole community of people out there that want children to succeed because children are our future. And I'd like to think that we have a strong one, and it's challenging. I get it, but it's possible. And I'll do the best I can to be one of those people on TikTok or Instagram that puts educational content that appeals to younger generations as well. I want to help dispel, and I know there's a lot of information out there as well that makes it difficult to know what's right and what's wrong, especially if
Mhm.
it's not to the most viral song out there. I'm going to do my best to be one of the advocates of public health and well-being.
Yeah, and parents, as you said, they're not alone. You should talk to your pediatrician. There's like health educators, there's nutritionists, there's a lot of support out there. This is a public health issue. Um, and I know that it requires a lot of advocacy from pediatricians and they have to see data, but like we know that this is an issue. And if you ask your pediatrician or somebody for help, they should be able to provide you with resources.
Yeah, Juliet, I'm again so grateful that you took the time to join me here. Um, and for all of you listeners out there, please continue to share this podcast to Health and Back with your friends and family. I do believe we have quality content on here that will be a good resource to all of you. And if not, just listening to my weekly banter with people that I care about and I respect in various industries like Juliet. But for now, stay sexy, beautiful people, and I'll see you next time.